presentation. Now I have the pleasure to move to our next distinguished panelist, Professor Dr. Muhammad Rizal, Martua Damanik. Professor Damanik is the Deputy for Training, Research and Development at the National Population and Family Planning Board of Indonesia. He is Professor of Department of Community Nutrition, Faculty of Human Ecology, IPB, University in Bogor, Indonesia. Professor Damanik did his PhD in International Health and Human Nutrition from Monash University, Melbourne, Australia, and is also a research fellow of Asia Pacific Health and Nutrition Center, Monash Asia Institute at Monash University, Melbourne, Australia. Professor Damanik has received many prestigious honors and awards like Sujana Uttama Medal IPB 2014, Tribute to Innovators and Authors 2015, IPB University 2015, Peduzi Gizi Award, Pergizi Pangan 2013, and the Best Lecturer of Indonesia in 2010, among other awards. So without further ado, I'd like to give the floor to Professor Damanik, and you have 10 minutes, Professor. Please, you have the floor.
Thank you, my colleagues, Mr. Tariq, for the nice introduction. So good evening, Assalamualaikum warahmatullahi wabarakatuh. Excellencies, ministers, Excellencies, PPD Executive Committee members, board members, and distinguished participants. It is my pleasure to attend the 17th International Inter-Ministerial Conference on South-South Cooperation in Population and Development. We commend the PPD, National Health Commission of China, and UNFPA for organizing this virtual Inter-Ministerial Conference. I hope all of you are in good health during this COVID-19 pandemic. In responding to the post-Nairobi Commitments on 3 zeros, Indonesia is pleased to report the progress as follows. I will report the progress into 3 chapters. First, Indonesia commitments, progress, and challenges, and how on COVID-19 pandemic affected the drive to achieve the ICPD program of action. Second, Indonesia commitment regarding COVID-19 response to continue the progress of action to fully achieve the ICPD and 2030 agenda through SSG, and third, Indonesia Partnership to strengthen the capacity of health systems in post-COVID-19. Now I will begin with the Indonesian commitments, progress, and challenges on how COVID-19 pandemic affected the drive to achieve the ICPD program of action. With respect to the implementation of ICPD program of action and Nairobi Summit, Indonesia commitment has remained strong. There are 3 ministries that are responsible for the 3 zeros, namely Ministry of Health, National Population and Family Planning Board, and Ministries of Women's Empowerment and Child Protection. The government of Indonesia has also put the spirit of the 3 zeros in its National Medium-Term Development Plan 2020 to 2024. Indonesia seeks to reduce unmet need for family planning from 10.6% to 7.4% in 2024. Maternal mortality rate from 305 per 100,000 women in 2015 to 183 in 2024, and to lower the prevalence of violence against women ages 15 to 64 years old in the last 12 months from 9.4% in 2016 by 2024. However, several challenges remain and the outbreak of COVID-19 might put more burden on the program in achieving those targets. First, issues related to the maternal death. Our policy in this area is focused on improving access and quality of healthcare to realize universal health coverage. We do this by strengthening promotive and preventive services that benefit from innovations and technological advancement. Specifically, our strategies include the following. First, increasing access to maternal and child health care, as well as premarital health counseling. Second, training on maternal and neonatal emergency care, improving the capacity of physicians in delivering the care using blended learning method and through coaching activities for public regional hospitals. The third, empowering communities. And the fourth, strengthening program governance through maternal perinatal audit, response surveillance, notification system on maternal mortality, stillbirth, and neonatal mortality, establishing a task force on the acceleration of maternal and child mortality rate reduction, and strengthening referral network. Now, the second issue is related to the unmet need. The COVID-19 pandemic has caused a drop in the number of visitors to family planning providers. The reasons are, first, fear of being exposed to COVID-19, and second, restriction on the daily number of patients and operating hours of the providers. The third, limitation of family planning counseling for delayed distribution of contraceptives due to the government's social restrictions measures. Fifth, limited availability of personal protection equipment for health workers. And the sixth, impeded efforts to improve the capacity of health workers in family planning service delivery, including long-acting contraceptives. So in responding to this situation, we have endeavored to build demand for family planning and maintain participation, strengthen access to and quality of family planning, and strengthen program governance. So in build demand for family planning and maintaining participations, we provide information and education on family planning service protocols during the COVID-19 pandemic that resonate with the audience's current emotional state. To disseminate information, we work with community radio stations, post videos and infographic through our social media channels, and utilize 166 car-mounted audio systems. Second, we actively engage the community, including the religious and local leaders, social media influencers, and artists. A solidified infrastructure has also been established, involving 24,000 family planning field workers and 1.3 million cadres to reach 81 million Indonesian families. And fourth, we also conduct online training on COVID response through weekly Facebook's live presentations are delivered in a program supported by USAID, participated by more than 12,000 family planning field workers. Now, in strengthen access to and quality of family planning issues, we organize activities that take advantage of important dates. For example, on the commemorations of the 27th Indonesian Family Day, we provided 1.4 million family planning services in one day. It is on 29 June 2020. To make sure family planning is delivered in remote, disadvantages and island regions, we collaborate with the Indonesian Navy and civil society organizations that provide mobile services from vessels. BKKBN will also provide long-acting contraceptive services as part of the commemorations of the National Health Day. The policy on pills and condom distribution by family planning field workers and cadres has been relaxed to enable them to provide door-to-door pills and condoms to eligible couples in need with a 3-month supply under the supervision of health facilities. And we also developed an application called Click KB that pulls 51,000 midwives throughout Indonesia, accessible to the public. Anyone can use this application to make an appointment with the midwife to avoid the queuing and crowds. The application also has a reminder feature on family planning acceptors to remind them of their next visits. Now, in strengthen programs governance, we publish a guideline on the delivery of reproductive health services amid COVID-19 pandemic for midwives, health trainers, and health workers. In addition, various ministries or public institutions and partners have also issued guidelines on family planning services and extensions activities during the pandemic and new normal situation. Distinguished participants, the next issue is about the gender-based violence, child marriage, and FGM. Throughout the COVID-19 pandemic, gender-based violence has experienced a sharp increase. GBV cases such as incestuous rape and sexual, physical, and psychological abuse, as well as other forms of violence, have been occurring because of economic distress. This is based on National Commission on Violence Against Women Report 2020. Moreover, we also notice an increase in child marriage in Indonesia as evident from the application for marriage dispensations, which allow early marriage that rises from 23,700 in 2019 to 34,000 in 2020, and 97% of those applications have been approved. Child marriage has been responded to by the issuance of Law 16 of 2019 that raises the minimum age of marriage to 19 years old for both males and females. In addition, we promote stronger commitment among regional governments, improve the capacity of human resource on gender issues, and develop a standard on improving the quality of women's lives and child protection. Now about the Indonesian commitment regarding COVID-19 response to continue the progress of action to fully achieve the ICPD and 2030 agenda through South-South cooperation. So we have carried out several surveys in addition to an ongoing study on the impacts of COVID-19 to our attainment of our programs. Indonesia has continued to update its recognized and applicable health protocols, study available literature, and adjust policies and strategies to make sure that the delivery of public services are maintained. Indonesia attainment of the ICPD program of actions and the 2030 SDGs is a national priority, as these agendas have been articulated in our National Development Planning document. Every year, the government of Indonesia submits its accountability report to the Indonesian people through our National House of Representatives. Amid all this, Indonesia has remained committed and determined to contribute its experience and expertise with other countries under the South-South cooperation. We are currently developing thematic trainings in 8 selected provinces. First, quality family village projects, which is in Yogyakarta and Bali provinces. And then supply chain management, which is in South Sulawesi province. Adolescent reproductive health, which is in West Java and South Sumatra. And then Muslim religious leaders, which is in East Java province. Microdata management family survey, which are in the Jakarta and Central Java. A postpartum family planning program, which is in East Java and South Sulawesi provinces. And 7 comprehensive family planning services training is in Jakarta and Yogyakarta provinces. So the quality family village projects in particular will be carried out together with Seychelles, the Republic of Seychelles. We are also preparing a hospital in Jakarta to be a site of training on medical skills for the delivery of family planning services in collaboration with the UNFPA. For this same purpose, we plan to extend our cooperation with a local hospital in the province of Yogyakarta. The 2 sites will offer distinct programs in terms of coverage and duration. The hospital in Jakarta will focus on the delivery of long-acting and permanent contraceptives, while the hospital in Yogyakarta will provide a more comprehensive training program. In this forum, we look forward to discussing the most effective funding scheme so that the learning sites, which we have diligently prepared, can offer the best experience to friendly countries who may need them. Third, about the Indonesian Partnership to strengthen the capacity of health systems in post-COVID-19. Presently, BKKBN cooperates with the Johns Hopkins Center for Communication Program and USH, focusing on social and behavioral change communication of program workers and the society to adapt with normal habits. BKKBN is also cooperation with UNFPA to measure the quality of family planning services during the pandemic. Indonesia is currently preparing a commitment of Family Planning 2030, partnership with the BKKBN as the chair, co-chaired by the UNFPA and the Embassy of Canada. This platform involves civil society organization, the private sector, and youth representatives to identify issues and agree on commitments as well as their success indicators. Indonesia stands ready to work together with all UN member states and national partners to accelerate our commitment in the ICPD and SDGs in the spirit of inclusivity and multilateralism. Indonesia are committed to spread the spirit of South-South triangular cooperation and mutual collaboration. Thank you very much, Mr. Moderator.